Government to consult widely with university managements and labor unions on acceptable payment system for university workers. TVC News Joke Adisa reports.
The federal government's decision to exempt tertiary institutions from the Integrated Personnel Payroll Information System, IPPIS, by the Minister of Education is one news that sparked excitement in the academic community. It's the end of a long-drawn battle between the federal government and the unions across the nation's tertiary institutions over the IPPIS. For years, the Academic Staff Union of Universities, ASU, and other tertiary institutions vehemently opposed the government-adopted payment system as a result of basic errors and the peculiarities of the institutions. ASU, for instance, argues IPPIS erodes university autonomy. Many of them came up with the payment systems they believe will better serve the tertiary institutions, while ASU developed the University Transparency Accountability Solution, UTAS. The Joint Action Committee of SSANU and NASU floated the U3PS payment solution as better alternatives. That decision to exempt the tertiary institutions from IPPIS tops the agenda at the two-day National Executive Council meeting of SSANU.
While celebrating this, departure from the past, while commending government for heeding to the call and cries of our labor unions, what we are saying is that government should think outside of the box.
Like SSANU, ASU, NASU, CONUA, and other unions commend the government's decision on IPPIS.
And the first reason they adduced is to the effect that it is distracting the tertiary institutions CEOs from their main duties.
They chart the way forward.
We improve upon the former system which the government now is saying the universities will be using to pay, directly. So this, if done, our members will celebrate getting their salaries on time, and that also they will not suffer, the absence or the denial of most of our allowances.
Government was not explicit as to where it is taking staff in tertiary institutions to. On what platform are they going to be paid? Are we not going to experience the same thing we experienced with IPPIS and so on and so forth?
For SSANU, other issues of concern include non-payment of 4 months withheld salaries as a result of the last industrial action, non-payment of clinical hazard allowance to health workers, and implementation of proposed wage increase.